Hello, I'm Rhoda Weiss, National Healthcare Consultant and Chair of Becker's Spring and Fall C-Suite Conferences, and also Chair of this new exciting virtual conference on marketing and patient engagement. We are witnessing seismic shifts among consumers, employers, and health plans to move to more personalized, purposeful care over a lifetime. Our experts today will share how marketing plays an integral role in how health organizations are reshaping doctor-patient relationships, creating holistically designed systems of care, innovating care delivery to meet consumers where they are, enhancing digitally connected options with access data and patient preferences to avoid point of care disappointments and ensure seamless, personalized, integrated care to achieve better health and better life for all we serve. I'd like to introduce you to our expert panelists. First, Kendra Calhoun is Senior Vice President, Marketing, Communications, Public Relations, and Digital Experience, leading these efforts for Avera Health's 37 hospitals, 16 service lines, 1,300 member medical group, Avera Health plans, and 40 senior living facilities in South Dakota, Minnesota, Iowa, and Nebraska. Previously, she was CEO of Amputee Coalition of America, COO Samueli Institute, partner in a public relations agency, and Alina Health Corporate Vice President of Marketing, Communications, and Public Relations. Next, Roddy Young, Boston Children's Vice President, Chief Marketing and Communications Officer, leads marketing, digital, media relations, social media, internal communications, web services, and design, and previously was press secretary at NASA and on Capitol Hill and a top exec at global agencies. Boston Children's is the nation's #1 ranked pediatric hospital, the nation's largest pediatric enterprise, the leading recipient of NIH pediatric research funding, Harvard Medical School primary pediatric teaching hospital, and treats more children with rare disease and complex conditions than anybody in the country. Next, Julie Washington is Senior Vice President and Chief Marketing, Communications, and Customer Experience Officer at Trinity Health, which is among the largest Catholic health systems with 115,000 colleagues, 26,000 physicians in 25 states, 88 hospitals, and hundreds of health facilities. Julie focuses on redefining marketing and communications and digital transformation and improving care experience to be more integrated, inclusive, and customer-centric. She previously was a market leader for Champion Pet Foods, Procter & Gamble, and Nestle Purina. Welcome everyone, and let's get right to the questions. First, how specifically are you bringing voice of the customer forward to uncover valuable insights and better understand what consumers really want and expect from their healthcare experience? And Julie, start us off, please.
Sure. Thank you, Rhoda, for inviting us to this conversation. So as we think about the voice of the customer at Trinity Health, our brand promise is that we will listen, that we will partner, and that we'll make it easy. And so what we've tasked ourselves collectively around our system is to deepen the listening capabilities we have, as well as our communications. And we're leaning heavily on the features of our EHR MyChart toolkit, such that we can look at, say, the narrative comments that we're able to obtain from our modern e-surveys. And of course, the communications that we have in our bedside rounding. We want to bring all of the touch points and informations to understand what is being said, as well as what's not being said, because together it will help us better meet the needs of each of the patients individually, as well as those who are residents in our care. So in short, we're listening by focusing on recovery, focusing on the responses that we provide, as well as.
That's great. Kendra.
Thank you, Rhoda and Becker, for putting this panel together. And I couldn't agree more with Julie. Listening is such a fundamental element of understanding where our patients are and what they need. What we're doing at Avera is journey mapping. And I know a lot of systems across the country are doing journey mapping. We're actually very much a partner with our medical group and our partner with our IT department in putting these journey maps together, working with our operators directly on what their experiences are with the journey, but also more importantly is journey mapping that patient experience and really understanding through their eyes how that whole experience has rolled out and looking at it not just from the care episode, But from the beginning of the engagement, where they're just searching for us online or searching for a health condition online, all the way through the care experience, onto the entry back into life, that longitudinal experience, focusing on how we're doing with building patient loyalty. So journey mapping has been a key ingredient for us.
Thank you. Roddy.
Hey, Rhoda, thank you so much. It's an honor to be here with Kendra and Julie. It's this is such an important topic. So Boston Children's, as you said, we are at a kind of a crossroads of two things. It's both an all-comer, all-children's hospital and a highly specialized place. I like to say we chase golden needles and golden haystacks. So across the patient experience, with particular attention to digital patient experience, we're trying to look anew at how we position our brand personality and by extension, the services we provide to meet patients and families where they are. So a long time ago, it used to be shared decision-making meant I'm the clinician, I'm here to share my decision. And now more than ever, we know that informed patients come to us with a lot of knowledge and we need to adapt to their care and decision-making needs. So meeting them where they are means thorough thought on online second opinions, thorough thought on online scheduling, thorough thought on virtual visits, thorough coordination of care visits for multidisciplinary care, all the way through post-care education and engagement. That's what a great brand should do, and that's what we aspire to do, and we're building that today.
We're kind of bouncing off what you were talking about. How are marketing and patient experience collaborating with IT, with physicians, with finance, billing, and other disciplines to advance the patient journey? Kendra, do you want to go a little deeper into your precision patient relationships and preference center?
Sure. We are really digging in with our medical group and IT. I think Roddy mentioned it very appropriately. The balance between the physician's voice and the patient's voice has to be struck, and it's not always the patient's voice first, and it's not always the physician's voice first. It's understanding where along that continuum they both interplay. And our role in working with IT is really more of a platform development. We're developing an enterprise-wide CRM system. We're very fortunate to have one EMR that we work across all of our system on, which provides that portal access that we can link into, and IT is a huge partner with us on that. It is from the PPR, the Precision Patient Relationship Initiative, it is really getting down to that precise relationship, that individual. You know, we are moving from big brand campaigns and volume driving campaigns more into micro campaigns, very targeted because of the data that we're able to collect to create those personalized journeys. And it's largely supported through patient education because that's what patients are craving. And we're finding that by automating patient education and creating thoughtful anticipation, 9 months, women are going to have a baby, and during 9 months, we pretty much know what's going to happen. In 3 days after you've had chemo, we know you're going to be nauseous, and we should be reminding you via text, email, or whatever your preference is, what is going to happen the next day, and that you have that nausea pill that we sent home with you. So it's really that longitudinal experience that we're looking at with our partners in the medical group and IT.
Thanks so much. Julie, you're doing a whole bunch in your very large national system. Can you talk about Together Space or Member Journey and other things that you might be doing?
Sure. Thank you for acknowledging that we actually use the word member. So it's an all-inclusive aspects of the journey that Kendra was alluding to. And so it's not just patient. When we look at our portfolio, we talk about being on the full continuum of care. And so we have a continuing care group. And so people who are residents in our senior living communities are important as well. What I'd like to highlight is the desire on our part, to your point of IT and advancements. So in our Mercy One ministry in Iowa, we actually have a pilot that we launched in, I believe it was like March, April, where we're leveraging our segmentation profile information such that we know that I think it's about 30% of Iowans don't have a primary care physician, and that their primary care visits have been down in Iowa for our ministry since 2020. So what marketing did in partnership with patient experience in our physician groups was to actually show that if we know patients are selecting their primary care physicians through word of mouth and going online by looking at provider profiles, we then launched a pilot such that patients and providers are now matched based on their answers to the segmentation questions, which is an attitudinal question toward their preferences for healthcare. So the physicians are answering about 26 questions or so. The individuals are answering 11 questions. And I think last month we had about 80% of our providers had completed the provider questionnaire. And what that looks like is based upon your response, we then give you a match, if you will, for which providers will provide the best care based on how you want to be cared for. And we are showing about over 50% of the people who have come to the survey, they've actually engaged further, meaning they've actually clicked to book an appointment. And so for us, this is what innovation, collaboration, creativity in its own way, and connections with Marcom, patient experience, IT, and our physicians groups have looked like in one of our ministries.
That's amazing. It's wonderful. And Roddy, I know Boston Children's are redesigning care. You're looking at the front door and care at home. Can you please share some of those initiatives?
Absolutely. So prior to COVID, we had already invested in a digital strategy. We call it Digital 2.0. I would say we're now in the 3.0. During that Digital 2.0, we were poised to engage patient families and referring providers in the way that they wanted, but the habit hadn't been formed. One of the benefits of COVID is that it forced the habit. We went up to nearly 70, maybe even more than 70% virtual visit engagement. And now we're feathering back down into the 20s, depending on the service. And that is a beautiful thing. So the universe that is Boston Children's is comprised of some things that all healthcare entities have, an IT department that is integral to delivering this. We have an innovation team that's thinking about new products and a way to engage. So we've done things like implementing real-time scheduling, which in a specialty organization is not simple. And really looking at the patient journey across, that each stage of the journey is served by us in a way that's fitting for the patients. Awareness, reputation building as a growth driver, consideration, providing answers. And it doesn't matter whether they're patients or not, getting answers because it's part of our ethos. They should be able to get it no matter where they're coming from, Abu Dhabi, Arizona, or nearby. All the way through to the end of the care experience. The care at home offerings, some of the things that we're piloting include behavioral health, which obviously in pediatrics is crisis beyond belief. And then looking at things that are applicable to care delivery, voice and AI offerings, chat, simulation, AR, workflows, all ways to make the care more seamless, faster, more efficient.
Thanks so much. So in that vein, what steps are you all taking to improve, preserve, protect, and reshape the physician-patient relationship by balancing digital technology with the human touch and ensuring digital technology establishes trusting human relationships? Kendra, please start.
Thank you, Rhoda. You know, it's balancing that doctor relationship with the patient. I don't know that we have the corner on that, but what we're looking at doing is the things that the physician sometimes gets challenged with in their practice is questions from our patients about wayfinding, or there's never enough time to educate the patient in that care episode in those four walls. How do we augment that doctor-patient relationship by thinking through what that next best action is? So we're implementing through our CRM platform these journeys that ride alongside with that care episode, that helps the patient to get that additional support that looks like it's coming from their care team, but it's all automated and approved through our service lines with the content. So we're helping kind of navigate that patient through their care episode and helping them with their handoffs. One of the things that we're looking at right now is working with our population health group around prediabetes. So we have run propensity models, and we understand there's probably about 37,000 people in our database as patients that are pre-diabetic. there's no way that we have enough capacity to care for those folks who come in to get any type of consultations or ongoing support. So we're putting together a roadmap of education that will help us do several things. Start to engage that population. Second thing is start to identify those who are activated enough that we can start to pull them into those care management relationships. So we're going to start to pilot that in the fall through our CRM process and through our relationship with our Pop Health Initiative. We're hoping that we can actually show some tipping back from the A1C, so they tip away from diabetic, being a diabetic rather than into having full-blown diabetes.
I love what Kendra said about not owning the corner on the market. We fit into that space. We really work very hard. Once you get into the stream of specialization, we're amazing. At the top of the funnel, what we're really trying to do is be very attuned to the solutions that we offer patient and families, and we work hard to make sure that we put them in the appropriate channel. In other words, virtual visits may work for some, but some really want an in-person visit. So being overt about asking, what type of visit do you want? And making sure that it's clinically appropriate. We don't want that our systems send patient families to a doctor and the doctor says, why did you put them into that channel? It's not clinically appropriate. The other thing we know is that the majority of our volume comes through our call centers. People still like to make appointments by phone. That isn't universal, and things are changing just as so many things are in the digital realm, but call center excellence, the management of patient families' needs and connecting them to the right care at the right time is really paramount in the design. But I love Kendra's statement. I would agree with that. We don't own the corner on the market in that space.
I'll add to it by putting one different perspective, which is my key partner through the member experience has been our chief clinical officer, who not only leads the medical aspect of our work, but he's also overseeing the work for IT. And so as we've been building out our member experience, we're trying to make sure we have the executive suite connected so that we take technology as well as our desire to serve on the patient's behalf and connect those tools. And so what we've been doing is ensuring that our physicians as well as our nurses are trained on our new patient experience tracking tool, such that everyone that has a role in that journey that Kendra mentioned has access to information with the goal that they will operationalize what they know. What that means is I should be able to improve, if I'm on the front line, the face-to-face interactions I have with patients, because I'm now able to leverage the technology in a more personalized way in the care that I'm seeking to deliver.
I think the more we do around creating personas, the more we can do to be more personalized is really important for us in our roles as the marketing and communication, our digital experience leads. So one of the things that's really relevant for us is that it's how do we communicate with our patients and how do they communicate back to us? And I know the portal is a huge tool for everyone using that communication, but what we've found is that everyone in our organization wants to buy an app for this, an app for that, that it's how do we, everybody wants to communicate to the patients. So we're setting up a patient messaging governance structure. We actually asked my team working with IT and others in the organization to do just explore where are our major communication centers with patients. And we've got 74 different major areas that want to send or are sending messages to patients on any given day. And within those 74 areas are multiple layers of communications that are going out. So we're looking to how do we align this? How do we not pelt our patients with so much communication that they're data rich and knowledge poor? So how do we start to help navigate them through? So we're setting up, first of all, a preference center, because we need to know how do our patients, consumers want to get their information? Do they want it snail mail? Do they want it email? Do they want it texted? Do they want a phone call? And we'll be able to set this preference center up so that people can pick how do they want us to communicate with them. And then we can start to streamline through our governance structure the communication so that we're not getting our people opting out and not getting any communications from us if we're emailing them. And then also how do we streamline it, how do we personalize it, and how do we start to really teach our patients how to use that electronic medical record portal to their benefit, especially as we keep adding more and more functionality, is how do we keep them current and engaged with that portal, because that becomes a real lifeline between the relationship of loyalty between them and their care providers.
You know, it's really wonderful because for years and for decades, we've always asked physicians, how do you want to be communicated with? Some still want fax. Do you want the specialist to call you in a few seconds? How do you want to do it? Now, finally, we're asking patients, which is really important. You know, for many years, not everywhere, because I'd like to say there are places that really understood that, but you know, many people have had issues moving from transactional to relational, from episodic to lifetime of care. You know, holistically designed systems of care, front loads investments to ensure convenient, easy access to the care continuum.
It's really a great question about relationship versus transactional. And from where we sit in pediatrics and marketing pediatrics, we think about this a lot. We strive across the patient's journey to remember that they're looking for answers where we can and where it's fitting. We want to be partners in that journey for them, offering the information they need and providing an ongoing relationship even after the care episode. So what does that mean? It's from a business perspective, a marketing investment sometimes is seen as a put on one episode, a care episode. And I think that's not the way that we should look at it. The equation of a marketing investment is really the investment to earn reputation built on what you have existentially for your brand across patients and family, the retention engagement of those patients and families, plus the value of that patient family over time, the loyalty and brand advocacy that you earn. That is the equation, that is the lifetime value. And it goes to get there, it can't be transactional, it has to be relationship driven.
Thanks so much. And Julie, you know, with your background, this was every consumer product you work for, it was about the lifetime value of that consumer. So give us some examples of what you're doing with that at Trinity.
Yeah, Rhoda, we will go back into my memory bank of CPG and retail language there. We would talk about our first moments of truth, as well as Roddy's point about loyalty. And so where we framed it within Trinity Health is, if we look at the vision, which we say that we're here to be the most trusted healthcare partner for life. Life is relational, right? It's not situational. It's not a moment in time. And so what we have been working and talking training is shifting how we think about the care we provide from a disjointed, if you will, just about that particular care, that particular appointment, to now more personalized and connected. So throughout Trinity, you would be able to find care that you need, but we need to ensure that we facilitate handing you off and referring you to those other physicians and care clinicians that can complete your services. And when we talk about membership, whether that's moving into a skilled nursing facility or a nursing home, wherever it is, or even taking care of someone in those moments of hospice needs, we're trying to ensure we move from being reactive and responding to being much more proactive around that personalized care. And it does change from how you see yourself to how you show up for others. And those moments of truth ultimately lead to a better experience and hopefully greater loyalty and retention.
You know, it's interesting. More than 40 years ago, I was one of the first two to have marketing titles. So people asked me, what is marketing? And they expected me to say, oh, it's a business function that identifies whatever. And I said, marketing is the sum total of impressions, experiences, and relationships that stakeholders or people or consumers, which includes physicians, have with your healthcare organizations. So I'm glad to see that this is really about relationships. And so next, how are marketing and patient experience supporting growth goals and engaging patients prior to, during, and following the patient interaction? Julie, I have you on screen, so go ahead and start.
Sure. So let's pick up with your definition. When we think about Marcom, a key aspect of what we do is about bringing in new patients and ensuring that there is repeat to that loyalty concept. When you partner then within patient experience, it is predicated upon loyalty. I want to go back because it's based on the experience that we deliver. So it's as important about the online brand when you're on our website, the ease of use, the access of information, can I get to making an appointment, all the way through the touch points to say, what are we doing when you arrive? How do we show up from the security guard to our EBS workers? Is it a clean place? Do you feel that you cared for? And then ultimately that impacts whether or not we're going to see the growth to our brand and reputation, as well as the growth to our business, because you can't beat word of mouth, right? That's those impressions and that social activation that is priceless. And so that's what we're trying to do, is that we don't even have to pay you to tell about what you received at Trinity Health, because why would you hold that back when it's been such a great experience and that they've delivered on what we promised?
You know, it's interesting when you talk about cleanliness. We used to do cleanliness audits and audits of organizations, and we used to ask every new employee to spend the night in a hospital bed. And the reason is because they could see the dirty, I'm pointing to my ceiling, I hope it's not dirty, that, you know, and they could see things and they can hear things and they can hear chatter and gossip and whatever. And even to go on a home health visit, to go on a hospice, to spend the night in a nursing home, because we wanted people to have that experience, because marketing is a lot about the experience. So thank you for mentioning that. Roddy.
These are great answers. Done well to us, marketing and patient experience work hand in hand. In fact, with marketing often leading the way, because we're often the first touch that patient and families experience. So one of the things that we like to deliver, and we know, is that data alone doesn't convince, stories alone don't convince, but together they can be a powerful duo. So our Answers Content Hub is meant to be a place where you can connect with our team, find out what works for you on your timeline. Should you come to care for us, trying to make that a seamless care episode, and that when you go through the care episode, that we are again in touch with you, staying informed, feeling loyal, and that we measure and repeat and refine those for future patient experiences. We're never done with how we do it. The thing that I heard Kendra saying is, one of the things, and I'm interpreting it, that is challenging is across the care continuum, particularly with specialties, designing marketing programs that are different is the ever-present challenge.
Thank you. Kendra, speaking of Kendra.
Oh, thank you, Rhoda. You know, I think that we're really going through a bit of a transformation in how we speak to our market, how we speak to people. You know, we have for years, we have been talking about, at Avera, we have all these services for you. Well, we're moving so far away from that now. Actually, our new Moving Health Forward branding campaign is about personalization. And our team decided to use you language. You know, start with you, the patient, the consumer first. Meet them where they are in whatever care episode they may be at, whether it's even a good healthcare episode in life. So we're really changing our narratives and our patient stories so that we start with that person first instead of with the organization first. And it's really turned everything on its head a bit for us, but it's allowing us to be more personalized. And we develop a lot of personas, as I'm sure Julie and Roddy's team do, and we are trying to drill down to be more personalized and develop that relevant content, because we don't want to just be relevant at the time that they are in a care episode. We want to be relevant when they're in life. And one of the things that we're really starting to focus on right now is how do we continue that relationship beyond the care episode. So everyone talks about the digital front door, and we have wonderful tools to engage and get folks involved and cultivate those relationships. We have great doctors and care teams, and we score off the charts with patient satisfaction. But when we get to the back door, or the back porch, we like to say in South Dakota, the back porch, how do we have them linger with us and talk with us and continue to have that relationship with us? And we're new into this. We're just now figuring our way around that, but it's everything from making sure that they know how to use their patient portal, making sure that we are communicating with them in the ways that they prefer, making sure that we have them signed up for our blog, and not just our blog, but we're able to personalize those experiences beyond just the general healthcare blog. And then the financial relationship. You know, we have a couple things at Avera. We have 2 insurance companies, and that's a pretty much of a unique opportunity for us to also span into that financing of healthcare and start to help educate our patients about the healthcare financing that they're going to experience and making that more simple.
The next topic I want to talk about is something that's near and dear to all of us. And it's how all of you are continuing to focus on health equity in both the traditional and digital space. Julie, I want to start with you. Julie, I've been blessed to have had many conversations and interactions with Julie on this topic. And Julie, you expressed, you know, to all of us and to me, and I appreciate every moment of them, of not assuming where people are coming from, not assuming that we have the same thoughts and backgrounds and how some get discounted.
At the core of the work our diversity, equity, and inclusion team have been working on is centered around seeing you the way you see you. And so how do I ensure not just the pronouns, but how we track, how we categorize, how we define individuals? And we used to do the old demographics. How do you bring that closer in a way that appreciates and expounds on the diversity of who we are as a collective American family, right? And so that's been true to what we've done. But if it's not just Black History Month in February, but we continue across all of the different holidays as well as celebrations to acknowledge that. And one of the things we did in 2020 is started the Advancing Together each month. Our diversity, equity, and inclusion team highlights different themes and brings different voices to a 1-hour conversation that is kicked off by our CEO, Mike Slabowski, but it's about making sure that we're aware. Part of it is that we don't know about that which is different from us. And what we've tried to do is educate ourselves. 115,000 people, there's a lot about us that's very different from the other. And so we've been doing a lot insular around advancing how we think, whether it's anti-racism training, our unconscious bias training. So that's been an insular, but if we think externally, we've been doing work, whether our Martin Luther King Jr. Symposium that we had this year that reached thousands. And the point is about, can we all come together, listening and solving collaboratively, whether it's one issue or another, or going to Capitol Hill. I think our diversity, equity, and inclusion team has led and partnered with advocacy, as well as our community health and well-being partners around things that matter most to the communities and the people that we serve.
Thank you. Kendra, we were talking the other day about the communities that you serve and what you're doing with the Native Americans, what you're doing with the Islamic Center. Can you bring us up to date on how you're reaching diverse communities?
Well, we have a department that's dedicated to Native American healthcare. We have a director that works only with our tribal leaders. He is a part of one of our tribes here in South Dakota. And that project is looking at healthcare disparities with our tribal leaders. We have put in dialysis programs. We've been looking at child health care. We've been looking at OB care. We are integrating very much so with those tribal leaders. And it's so important to have that trust, and building that trust is very challenging sometimes because we're learning as we go sometimes, and having our people on the ground working directly with the tribes and understanding their needs, and then trying to help us bring expertise to them, whether it's in helping them run facilities or standing up facilities on their reservations to help with care, has been one of the things that has been very near and dear to us. And we're a Catholic organization, as is Trinity, and that's very near and dear to our sisters' hearts as well. For our Islamic community, we found that years ago, our employee population was far more diverse than potentially our communities were. And what was happening is that our Islamic families did not have a place to gather. And our sisters came together and decided to build an Islamic family center, which is what we did here in Sioux Falls. And it was right after 9/11 that they invested in this. And it's been a real hit. I mean, they have been very appreciative of it. We helped manage it for several years, and now they have taken over the leadership of that organization and continue to flourish in the community. One of the things that we're doing recently is that we're embedding community health workers into our neighborhoods here in many of our communities. We have a growing diversity in Sioux Falls, and what we're finding is that, you know, access is equity. So how do we help make access more fluid, more available, more well understood in our communities? And that means we need to hire people that look like people, and we need to put them in the communities and build that trusting relationship. So that's what we're doing right now.
Thanks so much. And I know, Roddy, with your background and with your Dr. Churchwell and Boston Children's is really doing so many things in this arena. So can you share some of?
Yeah, it's one of the things that by association makes you so proud to work at a place like Boston Children's. It's a reflection that leadership starts at the top, and Dr. Churchwell, our CEO, would be the first to say that it's not just him, but he is clearly leading this with support from the board. Philanthropy, our former CEO, Sandy Fenwick, named, with her endowment, and named the Fenwick Institute, dedicated to health equity research, looking at missed care opportunities. We have a patient navigation health equity project, funding other actors to make sure that we learn how to do this better, looking at inclusion in our own workforce. We have Fenwick Fellows, even mid-career, advanced career, mentor program to really make sure that the pipeline is as strong as possible. Julie mentioned public policy, that you know, health disparities is a all-in exercise. It's not just Boston Children's problem. It's not just Trinity's problem. It's just not just Avera's problem. It's everybody's challenge. And I'm excited to be part of the team that really is digging in on this, and really credit to Dr. Churchwell for his leadership. And you know, probably more than most about who he is and what makes him tick.
Yes, you know, I have to put a word in for the first family of physician executives, the three Churchwell brothers, who are just amazing and faced a lot of discrimination and other issues growing up, and they're amazing. So what are your hopes and dreams in making patient engagement more meaningful? Roddy, you start.
So at the risk of maybe geeking out, we sit on a bounty of riches. The researchers who do the work, the clinicians, the doctors and nurses who care for our patients, as everybody said here, it's amazing, and couldn't be easier to do our jobs to tell those stories. The hope and dream is that the data sets that we manage and work across could be more holistic, so that whether it's, you know, managing a CRM, a PRM, marketing automation, call centers, to post-care, the classic phrase is, if you can't measure it, you can't manage it. We're making strides. We know we have work to be done, but if we can make it excellent and repeatable across the care continuum, that would be my hope and dream.
Thank you. Kendra.
I'm not sure I can say it better than Roddy did, but it really is about putting the patient's voice more front and center for our organizations, and balancing that doctor-patient relationship. You know, the doctors are the engine of our organizations. They are the relationship owners of the patient, but we've got to understand, how do we engage with patients as they have evolved, especially after the pandemic. We've seen such evolution of people who are very interested in me care and me this and me that, and how do we figure into that whole new concept of self-care and pumping your own gas, for instance, in healthcare. How do we start to connect those dots for consumers and for our physicians in this new world. And I see our role as marketing as helping to lay a lot of the track for us to go down as an organization in building that relationship a little bit differently, because we are a fabric of the organization, and I want patient experience to be a fabric of the organization that we're looking at from sun up to sundown and beyond the edges of that care episode. And to do that, we've got to expand the way that we think about our relationship with the patient, and that it's not just during the four walls of that care episode, but it's how are we engaging with that patient in their life space. And if we can figure that out, I think we have figured out the loyalty piece, because people want to know you care about them. And the way you care about them is you provide them information and support of what they need when they need it. And if I can figure this out before I retire, I'll call it a win. If not, I just want to do a good enough job that the person after I am here is able to do that.
Beautiful. Thank you. Julie.
So I'd say my hopes and dreams fall in two categories. The first one is a macro for the collective we, and it's around the interoperability of the data. So data has power, but only if it's connected across the streams, right? So we don't all live in a box. We don't live in just one place. And I want the data to be usable, that it can be predictive, that it can actually interconnect, not just in the silos of systems, but across systems, because we will be stronger. I think COVID has taught us that, of what we can do together that's going to make us collectively better. We talk a lot at Trinity Health about the common good. The common good has an aspect of interoperability, that what I know and what you know when put together makes it more meaningful for the patient and ultimately for their experience. The second one, we have termed our consumer here as Amelia. So you can't do all the segmentation. So we use Amelia often. And one of the things that I constantly remind us is, how about put a chair in the room for Amelia? Because when you're making decisions, you can't overlook people who are sitting there with you. And so the imaginary Amelia, how does she feel about the decisions that we're making, about the conversations that we're having? Have we really taken her into account when we're doing what we say we're doing and discerning on different topics? And so I desire for the engagement to be about Amelia, and what we do will truly benefit her, both in preventative, but also in care and cure. So it's a duality of hopes and dreams for me.
You know, I often think that the first day of my first job in healthcare, like a half century ago, a Catholic sister got up in orientation, and I memorized this. And she said, beyond the concrete and steel framework of the hospital is a fragile human thread of life connected to us, not just through medical and physical needs, but psychological, spiritual, practical, and family needs as well. Never look at as a patient as somebody with a broken hip or a broken heart or advanced cancer, but a human person that's attached to us through family, spiritualness, vocation, and everything we do. It is such an honor to be with you. You know, you can tell that we know each other. We all know each other because we're part of a weekly CMO group that meets every Thursday for the 175th time soon to share best ideas and best practices. And I just want to finish by saying, I love you all. I love everything you're talking about. And it really is an honor to be part of all your families in so many ways. So thank you for your time today.
Likewise, Rhoda.
Thank you, Rhoda.